Hello, good morning guys. So today we'll be seeing about different types of shock. So this video is for USMLE students, and I'll make a shock completely easy and simple so you can get all your questions right for your USMLE. So let's go guys. So guys, shock in medical terms means decrease in perfusion at the tissue level. Okay, so that being said, let's see about different types of shock. First you have hypovolemic shock. So secondly, you have distributic shock, which is divided into anaphylactic shock, septic shock, and neurogenic shock. Third, you have cardiogenic shock, and last you have obstructive shock. Obstructive shock is further divided into pre-pulmonary and post-pulmonary. You have pre-pulmonary, for example, pulmonary embolism and pneumothorax. Okay, and for post-pulmonary, you have aortic stenosis and aortic dissection. Okay, so first let us see about first type of shock, which is the hypovolemic shock. So before we go into the shock, I like to explain different parameters that are associated with shock. These are the 5 parameters that are associated with shock. So if you can clearly understand the concept behind the parameters and whether they increase or decrease, you will be able to answer all your questions in all your medical exam, particularly USMLE exam. Okay. So first let's see what CVP is. CVP is nothing but central venous pressure. Just try to understand what the concept is. So what is central veins? Central veins, you have 2 different types of veins. Superior vena cava, inferior vena cava. So the pressure in the central veins is known as central venous pressure. Secondly, you have PCWP, that is pulmonary capillary wedge pressure. It is also known as left atrial pressure. So that being said, the pressure that is in the left atrium is known as pulmonary capillary wedge pressure. Third, you have cardiac output. Cardiac output is nothing but the amount of blood that is pumped by the heart is the cardiac output. Next, you have systemic vascular resistance. It is nothing but the amount of resistance that is in the peripheral vessels. Okay, so it plays a very important role in the afterload. And last, you have the saturation of oxygen in the venous system. So these are the 5 parameters. That being said, let's jump into the first type of shock, that is hypovolemic shock. Just understand from the word itself, hypovolemic. Hypo means less. Okay, hypo is less, volume is the amount of volume. So less amount of volume. Less amount of volume can occur after, for example, trauma, if there is blood loss or if there is dehydration. Those are the reasons for less amount of those are the reasons for the hypovolemic shock. Okay, so if you can understand this hypovolemic shock, so you have less amount of blood in the circulation itself. That means less amount of blood will be coming to the right atrium. Okay, that means less amount of blood is present in the central vein itself because there is less amount of volume. So it will be decreased. Okay, if there is less amount of blood that is coming to the right atrium, less will go to the right ventricle and less will go to the left atrium via the pulmonary vessel. So as a result, so there will be decreased left atrial pressure. Okay, and if less amount of blood is coming from the left atrium to left ventricle, less will be pumped by the heart. So the cardiac output is decreased. Okay. Next, you have systemic vascular resistance. So always general rule of thumb is that cardiac output is inversely proportional to systemic vascular resistance. Here comes the question why. Just understand why. Okay, because cardiac output, whenever it is low, that means the peripheral vessel has to compensate for it. Okay, because of the autonomic response. Imagine less amount of blood is coming to the heart and pumps less amount of blood. The peripheral vessels will be constricted. That's why I marked it very narrowly. Okay, if it constrict, obviously it will increase. Okay, SVR will increase in this case, and the saturation of oxygen in the venous system will be low, right? Because it is a shock. Like I said, there's decreased perfusion at the system level. So if the tissues are less perfused, they will be draining out all the oxygen even from the venous system. So the saturation in the venous system will be decreased. So that is about the hypovolemic shock. Next, we'll see about the cardiogenic shock. Okay, just understand the concept. Just understand what is the actual triggering factor. What is the underlying cause? Here, the underlying cause in cardiogenic shock is the heart itself. Okay, the left ventricle. For example, let's assume that the patient is having MI. Okay, post MI, what will happen? There will be necrosis of the left ventricle. That means left ventricle cannot pump enough amount of blood. So you should start from the cardiac output is decreased because the heart is not able to pump. Always start from the underlying cause. Underlying cause is decreased cardiac output. So let's assume if there is decreased cardiac output, so that means there will be backing up of blood, right? So if the blood backs up, what happens? Eventually, there will be increased blood in the left atrium. That will increase the LAP and increase in the CVP. Okay, because backing up of blood. Then what will happen to the SVR? You guys tell me. Okay, just think about it. If cardiac output is decreased, that means it is inversely proportional to systemic vascular resistance. Because why? Because for the compensatory mechanism. That means it will increase. So what will happen to the oxygen saturation in the venous system, obviously it will be decreased because this is a shock. Okay, that means the oxygen in the venous system is so low that even the oxygen from the veins are being drained out. Okay, so third type of shock is distributive shock. Okay, the third type of shock which we'll be seeing is a distributive shock. So it is divided into three types of shock: anaphylactic shock, septic shock, and neurogenic shock. So let's see what is the pathogenesis behind it. In anaphylaxis, you have IgE. Okay, IgE will release IgE and also mast cells. Okay, mast cells will release histamines. Okay, histamines will cause vasodilation. Okay, so and secondly you have septic shock. Septic shock you have endotoxins. Okay, so these endotoxins will also cause vasodilation. So whenever they cause vasodilation, what will happen to the peripheral vessel? They'll dilate. So when they dilate, what will happen to the systemic vascular resistance? They'll decrease, right? So this is a triggering point. Okay, always try to understand the concept. Okay, this is the concept behind it. So whenever systemic vascular resistance will decrease, now tell me what will happen to the, so let's see, systemic vascular resistance is decreased. What will happen to the cardiac output? Like it is inversely proportional. Okay, so it will obviously be increased. So what will happen to the CVP? Because they are dilated, that means less amount of blood is coming to the right atrium. That means less amount of blood is being pumped to the left atrium. So it will also decrease. So only exception for saturation of oxygen in the venous system is in distributive shock. Here you will have to remember that it has increased. The reason being because the vessels are dilated. Okay, that means more oxygen can stay there for longer amount of time in the veins. Okay, so the last type of shock is the obstructive shock. Okay, so in obstructive shock it is divided into two types. One is pre-pulmonary and the second one is post-pulmonary. Okay, in pre-pulmonary examples would be pulmonary embolism and second one would be pneumothorax. Okay, let's assume pulmonary embolism. In pulmonary embolism, what is the pathogenesis? There is an embolism in the pulmonary vessels. Okay, imagine if there is an obstruction here. Okay, so the blood can't pass from the pulmonary vessels to the left atrium. That means what will be the PCWB? It will be decreased, right? So PCWB is decreased, and anything, look, blood flows from here to here. So if there's an obstruction at this level, there will be backing up of the blood into the right ventricle and also right atrium. So what will be the CVP? So it will obviously be increased. Okay, so now since less amount of blood is in the right atrium, less will go to the right ventricle and less will be pumped. That means cardiac output is decreased. Okay, and the last, so like I said, it is inversely proportional. It will be increased. SVR would be increased and SVO2 would be decreased for the same reasons, because it is a shock and less amount of oxygen is present in the veins in itself, because the whatever oxygen is available, the tissues are taking it. Okay, and the last type of shock is the post-pulmonary type in the obstructive one. So post-pulmonary, as the name says, it is past the pulmonary. The examples would be aortic stenosis and aortic dissection. Okay, so it will be at the level of aorta. Okay, so if the obstruction is at the level of aorta, blood will be backing up behind the aorta. Okay, so that means PCWB would be increased in this case, right? PCWB would be increased, and even CVP is increased because there will be backing up of blood. What will be the cardiac output? It will be decreased because aorta is obstructed, right? So what will happen to the SVR? It will increase because of compensatory mechanism. What will happen to the SVO2? Like I said, for the same reasons, it will decrease. So guys, this is all about the shock, and thank you guys.